truly believe that the journey is about the patient.
Patients feel that you're doing something different from other people.
It has really improved our business.
Dubai is a very competitive market. Patients look for perfection. You have to give them the highest quality of products, the highest technology, the best service that you could ever do to your patients.
We do get mostly premium customers who are willing to pay a premium amount for the best result. We have started with Smile Pro and the results are just phenomenal.
Melbourne's a very interesting refractive environment, and that's because a lot of the practices are kind of old and established. When we opened our practice, we were the first clinic in Melbourne to offer Smile and Presbeyond, and we're still the only clinic offering Smile. We've now got some other clinics offering lenticle extraction surgeries, which is good because they've kind of recognized how good lenticle extraction is. Opening my own clinics is a lot harder work initially, and it's very difficult because as clinicians, we're not taught the business side of any business. The best place for a surgeon is in surgery. I shouldn't be at the front desk managing the clinic. A lot of our patients can have their full assessment done by our optometrist, and the more time the surgeon can spend in surgery and the less time it can spend out of surgery means a better, more productive business.
Before we had the ZEISS Practice Development Consulting Program, the main challenge for us was how to get more patients for the refractive procedures. PDC works as a specialized marketing training for refractive surgeries. We first trained our call center agents how to respond to calls from potential patients, how to retain them, how to go back and call them again. And then we also trained our technicians and optometrists so they all understood the workflow. We constantly receive feedback from ZEISS, and that helps us optimize our marketing for laser procedures. It has really improved our business.
Patients want to know that we do a good job and that we do a safe job. They want to put their trust into us and expect us to do the best we can for them. And now we're using Refractive Workplace in order to do our surgical planning. It has two major advantages. The first is patient safety, because there's less chance of transcription error, and the other one is improved efficiency. We don't have to go into the OR and then start manipulating the data. It's already in the OR by the time we get there. I've got the Corneal Refractive Workplace on the laptop over here. Now, we've got it here in front of the refractive suite, but really I could be doing this anywhere in the clinic. I'll be planning it on the laptop, and the information will go towards to the Visimax and the MEL 90, and the surgery will take place.
We have all your tests that you have done on my system, on my computer, showing your pupils, showing how your lens looks like, showing an OCT scan of your eye, even your corneal topography, which we would decide which kind of surgery we're going to do. And we could just click on Save and Plan Treatment.
We're decreasing the margin of error, especially human error, from data entry, which makes patients feel that you're doing something different from other people. So it definitely puts you on top of the game. For us as doctors and for our whole team of supporting staff and optometrists, it was a very easy onboarding journey with the help, of course, of our local partners and ZEISS, I think it was as easy as it gets.
So let me give you an idea what a Smile Pro is all about. So here you can see the laser is making the correction for you without making any flap, okay? And after the laser makes the correction, it makes a very tiny 2 millimeter opening through which we remove the piece of the lenticule, all right?
Okay.
And voila, that's it.
In both our hospitals that me and Dr. Mitra practiced in, we've done thousands of specially smile cases and presbyond cases. Smile Pro lenticule extraction, the soft corneal touch and the laser time with the VisiMax 800 is fascinating. I usually tell the patients, just quietly count from 1 to 10. And then, while they're at the number 7 or 8, you tell them, we're done. They feel things go very quick. And then when you take out lenticule and comes out very easily, it's a 20-second procedure per eye, which makes it less than a minute for the whole procedure. Recovery is very short. He could go back to work on the second day. He could live a normal life within a couple of days after the procedure. So it definitely makes you feel happier for the patient.
What we have is a new software called Visualize. Now what the Visualize software gives us is a nomogram adjustment. We put in all our data of all the patients operated, both the pre and post-op. And then after we have collected, let's say 50 patients, and then we start analyzing their data and see whether we are going correct or we need nomogram adjustment. I had a beautiful case involving a father and his son. The son was about to start his higher studies, so I proposed to him to go for Smile Pro. On the day after the surgery, I saw the father enter the clinic carrying a basket filled with local dates. Here, dates are given as an appreciation. And he said, look, my son can see everything.
The patient's journey is really important. We want to make sure that they are comfortable and then confident with the service they're getting. And we want to give them not only excellent results, but a good experience.
Yeah, feeling great. It's probably one of the best things I've ever done, and just being able to live glasses free is just a blessing really, so loving it.
I was on a call with a patient and he was very happy with his visual results, but the thing that impressed him most was the efficiency of the clinic and how seamless the whole procedure was. We truly believe that the journey is about the patient. It's not about the surgeon, it's not about the center, it's about the patient. We want to make their journey as seamless and as efficient as possible.